Welcome to the International Association for Adolescent Health Pioneers Project. In this series, we have interviewed a range of experts from around the world who have led the way in promoting adolescent health in their countries, regions, or internationally. We wanted to listen to their stories and share their experiences so that these might be applied elsewhere. The members of the IAAH Education Committee were particularly interested in how these pioneers influence the education and training of healthcare professionals in adolescent health. In the following interview, Dr. Preeti Galgali is interviewing Dr. Evelyn Eisenstein, a pioneer in adolescent health in Brazil.
Hello, I'm Dr. Preeti Galgali, a child and adolescent medicine specialist from India. I currently co-chair the Education Committee of the International Association of Adolescent Health. On behalf of the Education Committee, we welcome Dr. Evelyn Eisenstein, a pioneer of adolescent medicine from Brazil. Dr. Evelyn is one of the first few doctors in Brazil to be trained in pediatrics and adolescent medicine way back in the 1970s. She was an associate professor of the University of the State of Rio de Janeiro. After her retirement, she continues to practice clinical adolescent medicine at the Clinica de Adolescentes and the Centro de Estudos, Integrados, Infância, Adolescencia, and Saude. Her current areas of interest are telemedicine and digital health and risks. She is a coordinator of the working group of digital health of the Brazilian Pediatric Society. She has contributed immensely to various international and national organizations, including the Society for Adolescent Health and Medicine, USA, the International Association of Adolescent Health, the International Pediatric Association, and to the Academy of Medicine of Rio de Janeiro. Dr. Evelyn, being a pioneer, you have been a witness to many changes in the field of adolescent health in Brazil and also globally. Please share with us the history of how adolescent medicine evolved in your country.
Hello, everyone. Nice being here. Thank you for this opportunity to share some of my history. It is, since I graduated from medicine, I was always interested scientifically in growth and development of children and adolescents. So I started back in 1972. I work at University Hospital in Rio de Janeiro with recreation, leisure activities for teens that were hospitalized. By chance, destiny, I had the opportunity to go to the United States. And so I did a formal training in adolescent medicine, first at the Children's Hospital at Harvard with Dr. Bob Maslin, then at Johns Hopkins University with Dr. Vernon Barnes, and then for 2 years with Dr. Felix Hill, who was himself a pioneer back with Dr. Gallagher. So Dr. Hill always did mentor about growth, development, nutrition, mental health, teen pregnancy. So in a certain way, I had a very good training background, as we say, capacity building. Anyway, so back in 1980, I came back to Brazil and back to the University Hospital where I belong. And I developed the whole adolescent medicine. At that point, people did not understand the difference between children and adolescents. So we have to start from the beginning, really, exactly defining what's the age group and the other age group. And the teens would go to an adult ward. The pediatrics department, the bed size, they could not fit. So they went to the adult ward. So at that point, I did write a whole grant, a proposal for a W. Kellogg Foundation. And they did approve a whole grant, and we did refurbish a whole, how would say, a whole ward just for teenagers. Up to date, we have 20 beds only for teenagers and an outpatient department in a house where we have a whole multidisciplinary team with social worker, nutritionists, dentists, eye doctor, ear doctor. So the work did go. We got then a grant with Pan American Health Organization, and we developed a whole training, a whole capacity training for not only Brazil, but Latin America. And so this work that started in a recreation room did grow and develop. And I always was very interested in nutritional, chronic undernutrition, malnutrition. I did my master in an anthropometric study for the whole Rio de Janeiro. And then we did a partnership with the school health program for the state of Rio de Janeiro. So the work did increase. And that point, as just answering the challenges were exactly malnutrition, infectious diseases, mental health. We had already violence, mental health problems. And then we had the whole HIV. So we had the HIV, we had to deal with HIV and together with malnutrition, infectious, chronic disease. And then, well, things kept going. And although I stayed connected in one way or the other, not only with the Society of Adolescent Health and Medicine and also the International Association for Adolescent Health, I stayed connected with Johns Hopkins, and we had a boy with a back tumor, and I was introduced to medical mission for children, and I got the first equipment that is about almost 15 years ago for doing telemedicine. And so we could discuss this case with the Hopkins specialists. So what happened is telemedicine and telehealth did grow also around teenagers. And for the past, I would say 10 years, because of the internet and because of the digital risks of the teenagers on notebooks, on cellular phones, I got also working with a whole group of experts in Brazil. And right now we are working so hard on that exactly yesterday, our president did approve, did, as we say, sanction a whole new law to try to regulate the social networks for children and adolescents and prohibit the use of cellular phone and smartphones in all schools in Brazil. So it is, I would say, a big step. So from growth, development, nutrition, going through HIV, COVID, vaccination, to telehealth, and now digital health. Try
Thank
to
you so much.
summarize it.
Thank you for tracing your wonderful journey, which is very, very inspirational. And not only that, you trained in adolescent health yourself from the real masters of adolescent medicine, if I may say, but you also carried that training back home and ensured with a multidisciplinary setup, which involved not only the health professionals, but also the schools, and I presume also teachers and also policy makers. And that was really which strengthened adolescent medicine in the country. Do you now have a specialty course in adolescent medicine in Brazil?
Yes, yes. Right now we have about 350 to 400 pediatricians working in adolescent health. Plus, we have gynecologists and obstetrician and psychiatry, psychologists to mental health. I have the support, complete support of the Brazilian Pediatric Society. And so whenever we have national meetings, we have we had the last National Congress of Pediatrics was in a city, in the South City called Florianópolis, and there were 5,000 pediatricians. And so each time we do capacity building, lectures, case discussion, and we also have a national meeting just for adolescent health. And the next one will be now in September in a city called Porto Alegre in the south. And we get about, I would say, 500, 600 specialists, and then it's a multidisciplinary because we have lots of nutritionists, psychologists, social worker, speech therapists. So it's evolving in Brazil. Also through the government now, we have the support. So from the health ministry and education ministry. So it's, as we say, slowly and surely, but we keep evolving.
That's wonderful. So it is not only the healthcare professional societies, but also the government which is participating in training and, as you always say, capacity building of not only doctors, but other healthcare professionals also who care for adolescents. Now I'll come back a little bit back to your personal journey. In all this, have you faced some challenges? And if yes, how did you really overcome these challenges? I know this is not an easy task from my experience in India. So I would love to know about the challenges that you faced.
I think it's a daily challenge to overcome, especially resistance. People are very resisting dealing with teenagers. First, because there is a myth that teenagers are healthy. It's not like that. You know, in developing countries, there is lots of diversity. Brazil has 5 big macro regions from the Amazon to the south and northeast and Rio de Janeiro, where I am. So are very different realities. And teenagers are, as we say, split between realities. And you always have to convince governors and, as we say, decision makers and policy makers about the importance of social protection, investing in adolescent health. Some days I do get down. Some days, and it's important to highlight the importance of the international network, to be part not only of SAM and IAH and some international medical groups that I keep, it's so important. It's what we call the peer, the interconnection. But I also go through phases, and right now I am a grandmother. I am a grandmother of 3. So it's always recycling in a certain way. All my pediatric background and all growth and develop background in different environments, So sometimes it's up, sometimes it's down, but I think what is most important, if I could say a message, is the commitment. We do have the commitment. I always say we have in Brazil, I'm sure India also, we have to look of so many poor, underprivileged children and adolescents, and how much they need a chance, they need a hand, they need a support, they need to be an adult there by their sides. And I think that's as we say, my bússola. I don't know how you say, have the word bússola, my guide to keep going.
So we do see that you're very passionate about your work and you have overcome lots of personal challenges as well as professional challenges, and also the battles with the policymakers to make them understand the importance of adolescent health and the importance of investment in training. So I would also like you to tell us a little bit about how did you what was this process in which you initiated training, and what do you think are, the important steps for training in adolescent health?
I think it makes all the difference. Training and capacity building are the most important tool. And even because I work with telemedicine and digital health, even as we say, the opportunity now to multiply with YouTube courses but even so, it is very important to know, as I say, who is on the other side of the screen, and to share knowledge. More and more, I think it is important to have this network, this professional network. People really don't understand what teenage years are. There's lots of media stereotypes, and we have always to deconstruct and reconnect teenagers with themselves and with their family values and with the cultural opportunities. And Brazil has, we have about, just to give an idea of the dimension, Brazil is about 220 million inhabitants, and about 55 million are children, adolescents until 0 to 19, about 23%, 25% are teenagers. So we have millions. So I always say in any meeting, there is so many people to need. So it is important to always have practical tools and health education. And I also work a lot with what we call, they say position papers. We say here documents through the Brazilian Pediatric Society. For instance, for about digital health, we produce about 12 now documents showing the health effects of screen. And these documents were so important for the health ministry and health education ministry. So it is a way to interconnect knowledge, expertise, you know.
Yes, so I understood from what you said was that it is not only the training programs, but the constant upgrading of skills as well as knowledge which is required by sharing and using the digital platform to really enable that kind of upgrading of skills and knowledge, not only nationally but also internationally by publishing, position papers which have relevance to not only our own countries, but also with the digital media really kind of impacting all aspects of adolescent health. We also need more training in this aspect and on an international and also a national level. So thank you, Evelyn. And now I would like you to share your recommendations for 3 essential key topics for training.
Okay, well, always growth and development, nutrition, always digital health, Brazil, cyberbullying, always prevention of sexual abuse, sexual exploitation, teenage pregnancy, all also through the digital health. Now we have, Brazil has vaccination is always a challenge. And right now, climate changes. So Brazil had a terrible flood in the south and last year, and we have, for instance, not only the warming effect, but fire, like there is now in Los Angeles, but here in the Amazon region. Actually, this year, Brazil will have what we call COP30, that is a whole international meeting about climate changes. And I'm already helping the component of children and adolescent growth during emergencies. We are right now writing this. And the other thing that also popping up a lot, and I'm not sure with you also in India, it's about autistic spectrum disorders. I think in a general mental health, and then specifically some deficiencies and autistic spectrum disorders are now a priority. So yes, that's a way to overcome, I think, some of the professional challenges we have.
Right. So I can see that what you're suggesting is that our current adolescent health training programs should have a nice mixture of the old, the routine, what we study, usually puberty, sexual health, prevention of sexual abuse, and also the new upcoming topics, which are climate change, the digital health, and an increased prevalence of probably, are we picking them up more or are they really increasing? The neurodevelopmental disorders, including ADHD, the autism spectrum disorders, the learning disorders. So that is something to really think about. Are we doing enough for the pregnant adolescent girl? Are we doing enough in pregnancy? So, following the lifespan approach as well. So that's an interesting mix of topics that you have suggested, Evelyn. And now I would like you to share your vision for adolescent health and training in future. You already mentioned the topics, but are there something else that you think is really important when it comes to adolescent health and training apart from the topics?
Okay, I think the key question, the crossroads is always resources. For training, we do need resources. So we do need not only the support of the professional organizations, but resources from foundations and governments and resources for developing countries are very important, so and because we do have a mission not only about health, but about peace. I think peace construction and social protection go through the teenage years also. So it is very important that we have what in the United States called advocacy. We don't have this professional here. We are the who do the advocacy or public policy for sustainability. So I think I would say just it is important not only to do this network as we are doing right now, but also convincing and bigger, how to say, broader, the word is broader foundation, international foundation about the importance of the adolescent year, as we say, the second age group, not only children, what we call the first 5-6 years are a priority in Brazil. But now we want to put at the agenda 10 to 20, how important that is to invest.
Yes, yes. So you're talking about the second window of opportunity that we have in the adolescent age to ensure that our young develop into healthy adults who are able to attain and realize their potential. That's so very important. And thank you for emphasizing on advocacy and also resources for sustainability of adolescent health education programs, not only for the healthcare professionals, but for the multidisciplinary professionals, also for parents. I knew you do a lot of work with the parents and also with the schools. So I think the training has to extend to almost everyone in the community. After all, it takes a village to raise up a child, doesn't it? So it's
we do say public health education campaigns like outdoors. We have, for instance, now Olympic Games and Paralympic Games. And we had a Brazilian teenager who won with a skate. So she introduced the skate and she's a champion. So if you give the opportunity and big groups do give opportunities for teenagers, I think that's the message.
Yes, Evelyn, so we also not only need training regarding medicine, but we also need training how to meaningfully engage with youth and how to really kind of make them champions for their own health. And that's also a very important part of health and training as it goes now. So thank you for bringing focus onto that we should be also knowing how to effectively engage with them, involve them in cultural events, and as we say, in giving them a positive dopamine kick. And that's so very important. Thank you so much, Evelyn, for reinforcing what Helen Keller said many, many years ago. alone we can do so little. Together we can do so much. So, three cheers for international collaborations, for local collaborations. It has been indeed a pleasure talking to you, Evelyn, to know about your journey of pioneering adolescent health and training in Brazil, your vision for the future, and how we can take it forward together. Thank you very much.
It was a pleasure to share. It is so important. Thank you very much for the opportunity.
Thank you, Evelyn.